ECD program. I would like to now give an opportunity to the co-chairperson in the select committee, Honorable Gillian, also to do some few opening remarks, then we continue with the meeting. Over to you, Honorable Gillian.
Good afternoon, members. Good afternoon, Chairperson. Let me also take this opportunity to wish the Chairperson of the Portfolio Committee, Member Gungubele, a speedy recovery. We know that he is a very strong person and he will fight this virus. Thank you, Chairperson. Allow me also to thank the Deputy Minister for presence with the department, because South Africa is waiting for answers from social services, as it is affecting the most poor and the most vulnerable people in our country. We're really looking forward to hear your strategic plan and also the plans on the adjustment of the budget to make life better, a better experience for our vulnerable communities within this country during this pandemic. Thank you very much for all members who signed in, and I hope we will have a fruitful meeting in taking the issues of the communities forward throughout this period as we face these challenges that all of us are facing due to this pandemic. Thank you, Chairperson.
Thank you very much, Honorable Gillian. Honorable members, before I give over to the Deputy Minister, Honorable Bokopane Zulu, to lead and make some few opening remarks and also delegate who's going to lead presentations from the different presentations in the department, I would like just to table a few proposals to the meeting without actually imposing them. Number one, the schedule for the meeting today was from 12 o'clock until 1 o'clock. I mean from 12 o'clock until 3 o'clock. Now, because there's a sitting of the NA that is actually taking place today at 3 o'clock. So there's an indication and a request from the Chief Whip's office and then also from the Secretary of the Portfolio Committee that we need to be done by everything at 2:30, so that we allow 30 minutes for members to move around from their respective areas to log into the sitting, and also some who are in Cape Town to be in the National Assembly chamber and so forth. So, so that's the first that I want to make to the meeting. Secondly, I also want to make a few proposals for the presentations of the department based on the agenda. We are going to give each presenter 10 and 15 minutes to finish the presentation. And then as to members, because this is a joint sitting, we also need to be accommodative of everybody. So we'll allocate to the members between 2 and 3 minutes per member, because we're going to have a long list of members and we need to be done by 2:30. If that is in order, honorable members, if there's no disagreement, if we are all in order, I see some members are nodding, which means they are in agreement. Take this opportunity to make some few remarks and also lead us through the presentation. But
through you, acting chairperson, can I request that the joint meeting adopt the agenda of today's meeting? If it's fine with you. Okay.
Yes. Can you please table the agenda, Lindy? Then we adopt the agenda and then we proceed with the meeting. Can you please also try to share from your side the agenda so that all members
can you see it? I try to share it.
I can't see anything from my side.
Don't see anything so far.
So far. Cindy, can you share the presentation from your side, please? Thank you. Chairperson, can you move it up, Cindy? Chairperson, we've done the agenda up, and now we're at the process of adopting the today's agenda. And the next item is the department's presentation on the revised APP. And then thereafter, the South African Social Security Agency, which is SASSA, will follow from 12:35 to 12:50. And then we'll proceed again to consider a presentation from NTA on the revised APP. And then we'll have allocated 35 minutes for the question time for members to engage on this presentation. And then we have about 15 minutes for the department and entities to respond. And our last item will be can you move up, Cindy? Will be our standing agenda item to get an update on the COVID-19 progress report. And then we'll have question time. We need by 14:30 to adjourn the meeting. That's the agenda, Acting Chairperson.
My hand is up, Chairperson Mvana.
Okay, thank you, Lindy. Over to you, Honorable Mvana.
Thank you, Chairperson. Good morning to everyone in the meeting. I am raising my hand in terms of adopting the agenda as it is because it was meant for that for today. Thanks, Chair.
Thank you very much. Honorable Mvana moves for the adoption of the agenda. Can we get the seconder, honorable members? Honorable members, can we get the seconder for the adoption of the agenda?
Ndongeni seconded.
Who's seconding?
Chair.
Can you come up? Yes.
Ndongeni.
Okay. Honorable Ndongeni seconds for the adoption of the agenda. The agenda is now fully adopted, honorable members. We can now give over to the Honorable Deputy Minister Opane Zulu to take us through. Over to you, DM.
Thank you very much.
Stop sharing, my loving. Yes, thanks.
Thank you very much, Chairperson. Good morning, honorable members. This morning we are here to table our revised annual performance plan as well as our revised strategic plan in line with the readjustments of the budgets as well as the COVID-19 to ensure that we are in line with what has been required. What we will be doing, Chairperson, thank you very much for letting us on the time. We will, if the committee allows us, we will prefer to share what we have changed instead of going through the purpose, the background, but we go straight to the slides that actually gives us a sense of what are the revisions in terms of the annual performance plan to enable the members to be able to know what the changes are. But just to add to the opening remarks of the chairperson, Honorable Stock, I would like to indicate that indeed we are hard at work to ensure that early childhood development centers will be opening in an environment that is conducive for the children, but also ensuring that the children will receive the PPE that is relevant for children. Amongst those would be masks that are on heads, as well as alcohol-free sanitizers to enable the soft skins for the children to actually not be that exposed. So those are some of the things we'll brief the committee on, because we needed to also make adjustments on our budget to be able to support, especially our rural based early childhood development, majority of them not receiving subsidy from government, who are struggling and who might not be able to open without support from government. And that is in line with us having declared the early childhood development for public good, but our commitment as a department to go towards universal access for children. We also would present the budget reviews, just the areas of what is it that has been amended. We will also thank the chairperson for acknowledging the new blueprint for the drug master plan, and we're committing to ensuring that the drug master plan is going to be implemented fully. And we are requesting that as the committee concurs with other committees, because we are supposed to receive mini drug master plans from the whole of government in response and their implementation strategies. We are hoping that the chairperson would be the committee, and the select committee would assist us to actually be able to achieve that. And yes, Chairperson, thank you very much. We are on course to introduce a lot of innovation in the gender-based violence plans, and making sure that we're not only talking about gender-based violence, but we are beginning to make a dent and to understand what are the underlying issues that we might not have achieved. The presentation will be as follows. We'll start with the Department of Social Development, followed by the Social Security Agency, and then lastly we'll take the National Development Agency. As indicated, Chair, with the committee would allow me that we go straight to what are the changes and what we have changed, because the background is, and the purpose I've already covered, that we're here to resubmit. We've already submitted the 5-year strategy, Chair, and the committee has approved. We're now today just bringing the amendments so that the committee can actually follow where we have made the necessary changes as instructed by the President to also make provision for COVID-19 and our response to it. So if the Chair allows me, I would then request the ADG, Linton, to actually go straight into the department and follow that approach. Thank you very much, Chairperson. May I hand over, with your permission, to the acting DG.
Thank you, DM.
Well, thank you very much, honorable members, Deputy Minister, Chairperson, for the opportunity. We will try and be as swift as possible as we are presenting. I think the Deputy Minister has gone through a number of the introductory remarks, and we want to just say that go straight to slide number 4. Slide number 3 is basically just the high-level organogram of the department. Slide number 4, if you could go there. Okay, as you know, we're tabling our amended APP in line with the as a result of COVID-19, and so we want to say that key to these revisions is our responsibility to new and some renewed demands for our services, including the demand for food, psychosocial support, and of course the provision of income support to the most vulnerable in society, including a range of other social relief measures which we have put in place, which we have reported onto this committee in the past few weeks since the start of COVID. And we're saying that we have responded by revising around 40% of our original targets, with 7 new targets specifically responding to COVID. We want to also highlight that we are not making any amendments to the strategic plan as such. This is also against the guidance from DPME. The only amendments that will be made in the strategic plans would largely be the forwards by the principles, but the mission and vision, etc., remain the same. So we have now 59 targets revised from the 62, and the realization of these targets demands really of us to use innovative measures, including the use of technology and leveraging on our partnerships. You can jump straight to slide number 6. So in slide number 6, our revisions maintained, of course, honorable members, the portfolio approach. So everything that we didn't do in silos, we did together with the provinces, as well as in-depth discussions with management and, of course, our agencies. Our revisions are also anchored on the results-based approach, management approach. We therefore use the logical approach or a science to these revisions, which I'll talk to a little later. And this decision-making framework also forced us to really think deeper around the innovative measures to employ, to continue to provide quality services to our people. Maybe I can jump straight to slide number 7, actually. The matrix that we utilized, you would note, we checked whether the targets were in the ENE or MTSF. We checked whether it was affected by a budget reduction. We checked whether under which highest level could the target still be delivered or implemented. And we also checked whether there was a legal or contractual obligation related to the targets. Those we would not amend. We also checked whether the target contributed to job creation. You'd note that we've had increasing unemployment rates because of COVID, but also job creation is one element that is fundamental to growing the economy. And so those targets that contributed to job creation, we did not really tamper with. But we also looked if the targets could be delivered using virtual means, including online capacity building and training, etc. So we also took into consideration the lessons that our previous performances, including the first quarter, so that we were able to improve and learn from these. These plans are also rooted in the district development approach or model, including government's overall development plan, which is the NDP. So if you go straight to slide number 5, you will note that we had 62 targets originally. We revised 25, we deleted 10, and we added 7 new ones. We now have a total of 59 targets. You can go to slide number 7. I've spoken to slide number 7. I've spoken to slide number 8. Slide number 9. Chairperson, our vision and mission remains the same. We are constantly reminded of our vision to create a caring and self-reliant society, which is also captured throughout the template. If you look at the bottom of your template of every slide, you will see that we have a caring a caring society, building a caring society together. So we want to say to honourable members that if you want to judge us, hold us accountable we want you rather to judge us and hold us accountable on our impact statements. When we report, we will, through our programs, policies that we design and implement, ensure that they contribute to the reduction of poverty, inequality, and essentially addressing we want to when we implement our work, want to always have at the back of our minds who relies heavily on grants for a living. We want to be reminded of Mr. Smith, whose son has been stealing from his house and selling what he steals from the house to feed his addiction habits. And we also want to be reminded of Mam Khoza, who is a victim of gender-based violence and relies on the centers for victims of gender-based violence. So when we do our work, we want to ensure that we are always having the ordinary citizens at the back of our minds who are essentially relying on our services. So we want you to hold us accountable, particularly in line with our impact statement. Chair, to highlight just a few changes, if you go straight to slide number 10. So I'm going to quickly just summarize this. We had an increase. We had to increase the number of individuals and households to receive food because of the high demand due to the economic impact of COVID. We adjusted our social grants related targets in line with the additional COVID-19 budget of 40 billion rands for the top-ups to all grants, as well as the special COVID-19 social relief of distress grant. We've had to strengthen and increase reach for our psychosocial support services to respond to the high demands occasioned by the need to provide the services to shelters for the homeless, and largely to strengthen government's fight against gender-based violence with recent unfortunate increases in this regard. In order to improve our monitoring and evaluation and oversight, we will invest, of course, in building an electronic or digital M&E system for the sector, and we've prioritized some key impact evaluation studies in order to improve and inform decision-making in this regard. A large proportion of the revisions relate to the reducing the number as from the preliminary assessment of Q1, to which we anticipate challenges in meeting and reaching the number of targets that we set out in this regard because of COVID. Our plans also include updates on some critical and most recent rulings by courts, in particular the litigation against the exclusion of special permit holders and asylum seekers from accessing the special COVID grant, and of course of late the ECD related judgment. So I'm going to ask Tabani to basically just deal with from slide 11 onwards. Go ahead. Yeah.
Tabani, unmute yourself.
Is Tabane around, DM? Is he around? Tabane?
Tabani is supposed to be around, Chairperson, because he's the acting DDG strategy, so he's supposed to take us through. Acting DG is Tabani, so that if he's still coming, we can move on to the next part of the presentation to manage time for the committee.
Yes, let's do that, DM.
While Tabani is going to go on to the different slides, acting DG, the next person that was going to speak after Tabani was DDG Ngumalo. Connie? Where are these DDGs? Acting DG, where's your group?
Nechipale is here.
But Nechipale,
Can yeah,
also here, DM.
Nechipale, please continue with your part in terms of the revised APPs and advise us on which page while Connie and Tabani are sorting themselves out. Go ahead, Nechipale. It's important
Tawani is supposed to take us to the slide, but it's not. We don't have. It's not shown there. It's centrally with Tawani. He must then go down to the slide that are there, because he's showing. He's sharing the slide that he must go to that, and then I speak if I'm requested. Where's the ATDG? Here.
Where are the DDGs?
DM, I suspect there might be because they are at the office at HSRC, there might be the problem there in that building.
Okay.
Acting Chair, I'm trying to get hold of them. I'm phoning all of them just to bring to their attention that they are needed here. So they don't pick up their phone, Taban. So I'll keep on trying because they're not here in the meeting.
Chairperson,
DM?
with your permission, if you'd allow me, because it looks like it's an HSRC problem, would you allow me to request SASA to continue so that, they are back. Are you guys back? HSRC team.
DM, I'm here.
Yes.
I can speak to the finances.
Yeah.
I just want to check if Tabani.
Can you hear me now?
Okay, we're back.
Tabani, are you back?
Yes, I'm back, ma'am. My sincere apologies.
Please, because now we are keeping the committee waiting. Can you pick up where the acting DG left off, please?
Okay.
High level, Tabani, the chairperson outlined time constraints and would like the committee to engage. Please. Tabani. Chairperson.
Sorry, can you hear us now? I'm not sure if you can hear us now.
We can hear you.
Hello? Okay, great. Okay, great. So Tabani will continue from slide number 12.
Can you guys try to sort yourself out because we don't want to frustrate the committee? Tabani, you have the floor to speak to the targets that we have changed and the ones that we are replacing. That is what you must focus on.
Okay. Okay. On program 1, we have indicated that on program 1 we've indicated that the 2 new targets that you have included relates to the M&E system that you wanted to develop so that you improve the monitoring and evaluation aspect, including the impact evaluation that you want to conduct. The other area on program 2 and 3, given that you've been providing the grants to dealing with the transfer of grants, so we have thought that we need to be clear about the transfer of grant, which has increased to about over 200 billion. And the changes that have been made as well relates to the policies that we wanted to consult. We have changed that to be a costing. We have reduced some of the numbers. We wanted to adjudicate about 95% of the appeal, and we have revised this to about 70%. And you'll see you have deleted some of the targets as they relate to and having us to have access to some of the files as relate to the SASA, and we couldn't access those. So we have made those revisions. We come to program 4. In notable changes are the new targets that have indicated to relate to the early childhood development centers, and we have deleted those that related to HR and so forth, because we felt it's important that we start looking at the reopening plan as well as in line with the Vangasali recommendations. We also had to come up with a target where we want to develop a database of all ECD programs. This includes both the registered as well as the unregistered ECD centers. And you'll note some of the programs, especially on program 5, it's mainly about the reduction on the number of our social service professionals in terms of those that you want to reach for capacity building, the number of social workers that you want to train. We have to reconsider exactly the numbers. And DJ have said earlier, this has been also been informed by the performance that we have been able to review performance from the first quarter. We have also made some changes with regard to the bill that we wanted to be finalized. For example, when it comes to the bill on social service professionals, we had thought at the beginning of when we're doing our planning that this would be finalized, but we have just revised it to say at least what you could achieve is about pre-certification certificate, which is one of the important requirements. Also, regarding the older persons amendment bill, which we are hoping that it will be finalized, we are committing ourselves currently, given the circumstances, that we will be tabling at least the older persons bill to cabinet rather than having that. All others, as I said, they relate to the reduction in terms of the level that you wanted to reach earlier. And there are some of the targets that we have come up with relating to our fight and efforts towards the social ills, mainly relating to issues of gangsterism, which contribute to gender-based violence as well, on social crime prevention. We have also come up with those in terms of making sure that we are able to build capacity and provide capacity building, especially to our centers that are there as treatment, as well as reaching our people. The nature drug management, I think the DM is speaking about earlier on. So these are just moved mainly. So this has been a revised total from the initial that we had from the 24. As I indicated, there are 3 new targets when it comes to program 4, which is the implementation of the national plan for action of children, as well as the 2 additional ones, as you see, that are highlighted with bold in the list, which is number 2, 5, and 6. These are the 2 new targets that we have added. On program 5, quickly, we have engaging with the provincial counterparts on our program relating to youth. As you'll understand, we always host youth camps each and every December of every year. We have sought to remove some of those targets. And because of the difficulties and the reprocessing of the budget plans, especially coming from the provinces. Also, some of our services we have reduced when it comes to the NPO application, as well as the monitoring of the reports that we receive. We have reduced the numbers from 98% to about 30%, because most of the officials who are dealing with those have got challenges in terms of having access to the tools of trade. And so we think because of that capacity that is limited, we will not be able to process all the application forms and also provide and be able to process all the reports. We have also removed the target that relates specifically to the capacity building, because we understand and respect the fact that our non-profit organizations, by and large, don't have access to these ICT means, and it would be virtually impossible for us to conduct some of these trainings online and so forth. So you can see that there's then that reduction. As DJ had said, we had only about 3 targets that have been reduced from the 62 that you had presented before this August committee and approved by Parliament. And with the changes that we have made, we've come up with 7 which are specifically COVID related, and it where we want to be measured. With that, through you, Deputy Minister, I'm sure then the acting CFO can just take us through the budget as we had indicated. Thank you.
Sure.
Good afternoon, honourable members. Can I go to the next slide, please? Can everybody just mute? Thank you. So the major change that we have for the 2020 adjusted estimates is that there's 3 areas that we changed our baselines. In terms of the social assistance grants, we have received 25.4 billion additional to our baseline allocation. That was to give the effect of the 350 grant as well as the top-up grants for the department for the period of 6 months. Then we had a saving of about 15 billion in April because we paid our social grants in 30th of March for 1 April. Treasury regarded this as a saving, and they reallocated this 15 billion back to the department, so that could increase the payment of the 350 grant and the top-up grant to 40 billion in total. Then the area of ECD conditional grant, we have an allocation for the ECD maintenance for the infrastructure. We made a case to National Treasury to repurpose this allocation towards the procurement of PPEs. So in the first 3 months of the financial year, there were very little expenditure in terms of infrastructure and maintenance to the ECD facilities, and we gave instruction that no further maintenance or infrastructure changes should be done, and that this funding should be then repurposed to enable the ECDs to become hygienically able for the ECDs to open going forward. So that allocation that was repurposed was 64.5 million in total. Then in terms of operational baseline allocation, there was 2 areas that we had to reprioritize our baseline. One could recall that there was an appointment of the 1,800 social workers for a period of 3 months. The cost implication of that is 33 million. We didn't have the funding in our COE budget, and we had to reallocate this funding from our goods and services. That came from welfare services, so the goods and services for welfare services was decreased with 33 million in total to fund these social workers for a period of 3 months. Then also what we've reprioritized is the amount of 23 million in total of the operational cost. That was for the procurement of the PPEs. The National Department went on a centralized procurement to buy PPEs for all its DSD welfare facilities across the country, as well as the CNDCs. That costed about 21 million in total, but we also had to procure for the National Department to get also the National Department in terms of the PPEs. So in total, our baseline operations was reduced with 56 million. We only have a budget about 400 million for this financial year, and that's why we've changed most of our APP targets to cater for this additional allocations and the reprioritized allocations. Chair, that's in brief and just in terms of the changes for our 2020 E&E baseline. And I will stop there. Thank you.
Thank you, Fanny. Maybe if we go to slide number 27, I can quickly just round up. We are learning a number of lessons, even though the pandemic has really become difficult for us and indeed is affecting our service delivery environment. But some of the lessons we are learning is COVID is really teaching us to be a lot more agile and to be able to respond to shocks, whether it's disasters or emergencies. And we are noticing that during COVID, a lot of the work is actually being pushed much quicker, or rather we are able to respond to certain things in a much faster manner. We're also learning that, in fact, we've had to increase our investment into tools of trade and our ICT infrastructure to reduce face-to-face contact, of course, but including having to make an investment into digital M&E systems to assist us in terms of gathering real-time data, our planning, reporting, and of course accountability. But we're also learning to enhance our coordination and cooperation with the three spheres of government so that we're able to again improve our efficiencies. The other important lesson that really we've learned and continue to learn out of this is the need to leverage much more on partnerships, particularly with the private sector, NGOs, and of course other government departments, but more so with citizens. So these are some of the important lessons that we are learning. Chair, we will be submitting, of course, our APP before the end of business today as directed by Parliament, and I want to apologize for that technical glitch that happened earlier. It's the learning process. Lastly, recommendations. We are of course hoping that the committee would consider the revised APP annual performance plan and notice a significant readjusted budget occasioned by funding of COVID-19 interventions. Thank you very much, Chairperson.
Thank you very much, Acting DG and our DDGs that have made the presentations. I think we are running behind schedule, so we need to move over the necessary speed. I would suggest that we give over ADG, we give to SASA now, so that SASA can take us through their presentation.
Thank you very much, Chairperson. Sise Memela, can you just focus on what we have changed?
Thank you very much, Deputy Minister. Thank you, honorable members. In order not to waste time, I will ask Rapahle, our executive responsible for strategy, to go through the presentation, and then I will focus more on the COVID 350 stuff when we discuss the COVID initiatives. Thank you, sir. Thank you, Chair. Rapahle.
Rapahle.
Good morning, Deputy Minister. Good morning, Chairperson. Good morning, honorable members. I can't see the screen. I'm just checking if you can see the presentation.
Yes, we can.
But yes, I can't see it personally. I'm not sure. So I was trying to see what should I remove in order for me to see the slides where I am. Can I request the Secretariat maybe if they can load it for me so that I can be able to present better?
It's loaded, Rapahle.
From my side, I can't see what you are seeing, Sio.
Okay, Chairperson, while SASA is sorting themselves out in their presentation, can we move on to NDA?
I think let's take that approach, DM. Let's move to NDA. Is NDA ready? Are you ready, Mam Zobe? Are you ready?
Haibo. Okay.
Good afternoon, Chairperson. Good afternoon, honorable members, Deputy Minister. Thank you for the opportunity. We are ready. This is our presentation that we'll be going through as guided by the Deputy Minister. We'll zoom straight to the changes which we have effected, not merely changes per se, but the recrafting of some indicators or targets that we have recrafted based on the COVID pandemic environment. We are not changing, Chairperson, honorable members, we won't be changing our strategy. It's only the focus of the APP. Can you move, Ben? Mr. Morule, please move slide.
It looks like the same problem that Rapathle experiences. I'm experiencing because I can't see the presentation at all on my side. I'm not sure what leads to this. My apologies.
Can you press? I will talk to it. If you're able to press, I can see the presentation on my part.
Yes. Yeah, that functionality is not here. I can't see anything at all on my side. I think it must be the settings on our side, but as I navigate, I can't determine where. Perhaps if I may suggest that the Secretariat loads it on their side, because then we will be able to see it then on our side, and then we can take control of the presentations. If that is okay with the Secretariat.
Yeah, I've lost it completely on my part now. My apologies, Chairperson. Oh, who has taken over the screen?
Yes. Lindiwe, do you guys have the presentations? Was it sent to you so you can load it from your side? This is a disaster.
Chairperson, it's Honorable Ngwenya. Can I make a suggestion, please?
Okay, Honorable Ngwenya.
We have the presentations that were sent to us. Can everyone look at their presentations on their sides to save time and allow NDA to continue looking at maybe using her laptop or something to save time? We all have the presentations on our laptops and on our iPads.
Okay, good, Honorable Member. I think I'm also agreeable with that proposal. Can we do this, Honorable Members? Can we allow NDA to present, because of it looks like we've got some technical issues. We have the presentation screen so that all of us are able to see. Let's allow NDA, and the CEO will present what she has in front of her. And then we, Honorable Members on our side, we have our presentation, right, so that we can continue. And then I request that SAPSA must also sort themselves out, and then they are ready, and then we don't waste any further time on this. Honorable Members. Can we go to NDA?
Agreed. Thank you very much, Chairperson. Chamo, can you speak to the presentation and switch on your camera? Because we're live on the Parliament channel. At least the community must have something to look at. Switch on your camera and talk to the presentation as all members have it.
Okay, DM. Thank you, DM. I hope I'm showing on that side. Chairperson.
Yes.
Am I audible that side?
Yeah, no, you are audible. You can proceed, my sister. Proceed.
Oh, okay. All right. Thank you, Chairperson. Honorable members, our mandate is still the same, and our strategy hasn't changed. And the purpose is to present the revised APP that has been occasioned by the COVID-19. In our programs, in summary, we have 19 KPIs in terms of targets that we'll be looking into as NDA during this financial year. And in these 19, the split is as follows. The program 1 has 7 targets, program 2 has 7 targets, and program 3 has 5 targets. As I indicated earlier, that we are not going to be reviewing any targets per se, but we have recrafted some targets, mainly in program 2, which says that program 1 and program 3, nothing has been changed, added, or deleted, and nothing has been recrafted. In program 2, if I can quickly move to program 2, we have looked into the manner in which we want to increase the number of work opportunities created as a result of the CSO development interventions. There we are looking into making sure that the opportunities that has been brought about by the pandemic through volunteers program is one area where we want to strengthen in ensuring that there are work opportunities that are there. And secondly, in terms of the target, we are targeting 2,000 because as we see since COVID, we had recruited 580 volunteers through the civil society organization that are within the database of the NDA. And in the outer years, we'll be looking, we're hoping that the situation on COVID pandemic will have stabilized, then we'll downscale to empower more civil society so that we can have in the outer years more volunteers, but on the equitable spread. We want to ensure that the increased income that is generated by the CSOs during this period, we want to take opportunities of the manufacturing and the production of the PPEs, where cooperatives and small businesses that we had supported over the years, they benefit maximally, working with the National Treasury in assisting with the database of the readily capacitated CSOs to deliver on the cloth mask, to deliver on the material that is used by our volunteers and other departments when they're doing their work. But those are the only areas which really we had to tweak the crafting within which we want to maximize the benefit that has been brought about by the COVID itself. That is just program 2. We want to ensure that the empowered CSOs are able to address poverty eradication interventions with the digitization of the program within which we'll be getting into. That is KPI 14. Another area which we have looked at in terms of program 2 was the area of capitalizing on the strategic partnerships. Before we had about 13, that is last financial year, but we have drawn down to 5 because we want to make sure that we massify the value of the partnership, not the numbers of partnership, but the values of those partnerships. So further to that, we want to look into the integrated development model initiatives, that is KPI 10, number of integrated development initiatives. We want to piggyback from the district development model to say NDA has to be the champion in the field of coordination of such initiative that is involving all other government departments that has to do with development of communities. Those are the only areas which had recrafting in terms of the KPIs. However, the KPIs remains the same. We just had to recraft the KPIs by itself. I will take through the areas where our measures are now focusing in the response of the COVID per se, the areas that have been changes that have been brought by the COVID itself, how we had realigned our budget in order to ensure that we align our interventions with the budget that we have reprioritized from the kitty that we already had. The low priority vacant posts we had to postpone just to ensure that the monies that we were to utilize to recruit more people due to COVID, where we're not having interface with the CSO by nature of our interventions, we could save some rands and cents to invest to the recruitment of the volunteers. The travel budget and the accommodation and S&T, due to the nature of the COVID, there was a huge saving to the tune of 3.8 million, which was assisting us a lot in ensuring that that savings goes straight to the impact of the projects that and programs that we administer in communities remotely, so more especially in the volunteer program. We have not renewed operating leases, especially the ones that had contributed in the accumulation of irregular leases that were procured historically. So this was part of addressing the historic irregular expenditure while we piggyback on the partnership through the portfolio, which is SASSA and social development in the main, where we are having the office sharing space in making sure that those leases where we don't have to renew, but we are able to provide service continuously. And other studies, other areas where we could do the savings was around research studies, where there is now a partnership with the portfolio approach. SASSA and department, there is a technical team that is looking into the holistic research that the portfolio needs to look at into the issues of the COVID-19. Then the M&E and admin cost that was there, we have taken a few rands and cents around the intervention and the personnel that was responsible for that area to say we are capacitating the CSO to run one part of M&E mainly on volunteer programs. So there was a sharing of a resource there with monitoring and evaluation. I would request that now I hand over to CFO just to take on the part of the finances. If CFO, you can just punch through the areas where it mainly talks about the budget where we have reprioritized. Thank you, Chairperson.
Okay, thank you, ma'am. So good afternoon, honorable members. I'm referring to the slide, which is a high-level indication of our statement of financial performance, which is the budget and how it's been reprioritized. So in the first column, you would notice that indicates our board-approved budget. The second column, we indicate the areas which we've targeted for reprioritization. And in the final column, we show our revised budget, which is COVID-19 specific and focused on COVID-19 interventions. So our revenue from DSD is still at 224 million. Thankfully, it has not been cut by National Treasury. And we also have additional income from sundry income, and which is management fees that we raise in our partnerships, as well as interest income. Now, our main programs, we have 3 programs in the NDA. So we have administration and governance, which is program 1, and program 3, which is research. And then our main program, which is focused on core operations, is program 2, which focuses on CSO's development. So in terms of program 1, which is administration and governance, you would see that the original budget was 116 million. We've managed to reprioritize 7.7 million out from there. And that budget has been reduced to 108 million. And then in terms of program 3, which is research, the original budget allocated was 10.8 million. We've managed to locate 2.6 million in that program, which and the budget there has been reduced to 8.2 million. So in total, we've reallocated approximately 10.3 million worth of funds from program 1 and program 3 into program 2, which is our main program. And in program 2 specifically, our existing sub-programs of mobilization and formalization and capacity building, we've reduced the budgets there by approximately 10 million. So we are left with about 1.1 million in mobilization and formalization. And this is mainly due to activities that have been curtailed there due to the COVID-19 restrictions. And the 1.1 million we've left in mobilization and formalization is purely to focus on special projects and on technical support. Then our 2 new sub-programs would be mainly the volunteer sub-program, which we've allocated 32 million to. So you know that this program focuses on COVID-19 advocacy, as well as supporting the programs run by DSD and SASSA. And then the additional new sub-program would be the digitization of CSO development initiatives. And this is a program that would focus its attention on digitizing the mobilization and formalization and capacity building initiatives through an e-solution that will be then made available to CSOs. So we've allocated 2 million in this financial year to the digitization efforts. And so you would see then in total, Program 2 has increased from 103 million to 114 million, which is an increase of about 10.3 million. I think that's a high level, summary of where our budget stands and, where and I think the CEO has already touched on the areas that we focused on in terms of locating budget to be able to focus on our COVID-19 interventions. But I think in the main, our main program then for this year would be the volunteer support program. Thank you.
Thank you, CFO. Thank you, Chairperson. We are here this is our conclusion, to say we are here to present a revised APP for the Portfolio Committee to note and consider our revised APP for financial year 2020-2019 and the reprioritized budget accordingly. Thank you, Chairperson. Thank you, Deputy Minister.
Thank you very much, CEO, for the presentation. Honorable members, can we now move to SASSA? Is SASSA ready, DM?
Thank you very much, Chairperson. SASSA is ready. Rapatla, please take the floor.
Okay, thanks very much. Members, I will start with slide number 3 without wasting your time. I'm hoping in the meantime the Secretariat will be loading. On slide number 3, just to emphasize that the focus of SASSA in terms of the retabling of the APP will be mainly on the new measures that were implemented and new interventions as were announced by the President in terms of implementation of the COVID-19 measures, socioeconomic measures. We are also looking at some of the technology.
Okay.
Yes, I'm trying to load. Okay?
Can you please mute yourself?
Okay, thank you. Thanks.
You can continue, Rapatla, because honorable members have the presentation.
There were technology innovations that we invested in terms of taking advantage of the new opportunities that COVID-19 was presenting to us. And we have also had to reduce or limit some of the targets in order to make up for the lost time during the lockdown on some of the things that we could not implement. If we move to slide number 8 in particular, we start to focus on the direct interventions or the changes that we have made on the APP. As DSC has mentioned, we will not be retabling the strat plan, as we found that all the changes that we were making were already accommodated within the broader outcomes that we have tabled within the strat plan. The first outcome that is the primary intervention for SASSA is that of reducing reducing the poverty levels in South Africa, and this we do by providing income support to South Africans who are unable to support themselves or their families. In terms of this, the major intervention has been the top-up grant of 250 to the different social grants that we will be implementing from May to October 2020. In this regard, we have also had to make some enhancement on the systems development in order to effect the changes. As members would be aware, the announcement by the President were made on the 21st of April, and the implementation had to commence on the 1st of April, which gave us limited times in terms of doing system changes and doing and the quality controls around that. And therefore, that's why we had some challenges which we'll be accounting for in the quarterly report as we give progress. In terms of the top-up for 300 grants for child support grants, also which was implemented only for the month of May, we did do the implementation. There was no major system challenge around this. However, the major issue that we have had to deal with was the issue around communication, so that we can provide clarity to the citizens in terms of the implementation of the top-up of the CSG plus and differentiated from the new caregiver grant, which was supposed to commence in June. And the other measure was the 500 caregiver grant that we're implementing from June to October. Although this is easier to implement, but the communication around it and the misunderstanding among the citizen was a major problem that we have also had to deal with. So we have also had to enhance the communication measures in this regard. On the new special COVID-19 SRD grant, this was a new measure altogether, which required us to look at the way we implement it, but also to include new systems, but also to say, because of the COVID-19 challenges, we were forced with a situation where we've also had to look at how do we accommodate the new people or the majority of the people that would be wanting to apply for this. And this necessitated for us to implement new access measures which were technology driven in order to limit face-to-face intervention. I'm now on slide number 9. Can I request that we move to slide number 9? Secretariat, if you can move to slide number 9, but in the meantime, I'll be moving. Here we are still continuing on the reduced levels of poverty. In terms of the review of the social grants, we have suspended all the reviews in terms of social grants because in terms of the regulations of social assistance, our reviews require people to do face-to-face interventions. And because of the older persons and the people with disability who are mostly affected by the COVID-19, it was important that we suspend the intervention and ensure that the grants continue to be paid despite the reviews not having happened. We have also had to extend the temporary disability grants, care dependency grants, the foster care grants, which lapsed from February to June, to ensure that they continue to be paid, and these payments will continue until the end of October. Now that the SASSA offices have been opened, the applicants in this regard can start to go gradually to the SASSA offices to ensure that they do the new applications in this regard. The extension also included the unclaimed grants for which normally after 3 consecutive months, if they are not withdrawn, would suspend. But during this COVID-19 period until October, we have extended that. We will not be amending that. And this amendment, we will incorporate it in the operational plan and not in the APP per se. On the payment of social grants, we have also had to make changes on the payments. The major change that we have made on the payment of social grant was to introduce the staggering of the payment of social grant. This is a measure that we have always been working on. However, with the advent of COVID, we have had to fast track this intervention, which led us to the situation where from now on, people are paid on from the 3rd. We have removed them from the month-end congestions that were there, which has also brought relief to the citizens, but also to the national payment system in the sense that already we are starting to see the positive results in terms of the staggering. We have also had to separate the payments for older persons and for people with disabilities. So providing these separate payment dates, it allows people to have ease of saving them either at the ATMs or also at the point of sale. So there's no congestions with the younger people who are receiving the grant. Moving to the next slide, slide number 10. In terms of improving the customer experience, this is the ease at which some customers are served. We have now introduced electronic applications channels, which started with the COVID-19, where we introduced electronic channels such as the USSD, the WhatsApp, and the website applications. We have now extended these applications to cover all other social grants, and we are busy piloting, and we will be rolling out in the 4th quarter in terms of the new applications, online application systems. We have also had to enhance the systems on SOCPEN, as I have already indicated. But other than that, one of the long-term solutions for SASSA has always been that over the long term, we want to gradually migrate from the legacy systems to the new ways, because with the old system, it's difficult to make changes as things happen. So, but with the COVID-19, we have started to use the Oracle base for processing of SRD, and we will be migrating gradually to say, how do we look in terms of the future of SOCPEN in the long term, in terms of more exploring Oracle as a way of dealing with social grants. So in the 3rd quarter, we will be piloting other new ways to say, how do we start to introduce this gradual migration. In terms of strategic management of data, we have also introduced, for the first time, we have direct interface with the UIF. We have access directly, which we had with DHA, but it wasn't direct information that we had. Now we have direct access to SARS, we have direct access to NEFSAS, we have direct access to PESAL, and we have direct access to PESOL and other government systems, including the information from the criminal justice system. This helps us to do verification for people who are applying. This data we will be extending the service to utilize also for other social grants, so that we don't only rely on what applicants are telling us, but we have the data that can use as a source. More than anything, we have also established a new database which will serve as a central net database for poor households across the country. This database, it came as a way of dealing with the new COVID grant, but we have seen the benefit of having such a database, and we are aware that government has been looking at this opportunity. So we will be enhancing and cleaning this data so that in future we can look at it as a major driving force for serving poor people across the country. In terms of serving our staff, we are also saying that we need to review the policy in our policy and strategy for HCM development and managing staff, in order to ensure that the utilization of staff and managing staff remotely and doing staff rotation is formally structured and it accommodates the new realities that come with COVID-19. If we go to the slide number 12, where we are starting directly in terms of the APP changes that we have made. I've already spoken to the top-up grants, and we had to implement as relief measures for COVID. I've spoken to the 350, and I've spoken to the issues about the care dependency, the reviews that we have included for care dependency, disability, and also the foster care. We have also introduced the electronic processing of Regulation 26A mandates in order to reduce the face-to-face interventions, because this was also increasing the number of people that were going to SASSA office to increase services. So we found this was a quicker measure to implement. We are also implementing the multiple channels, as I've indicated, for applications. And already we started with SRD, and we are extending to all other social grants. And we are just giving the reason to say this is to minimize the long queues at the SASSA office, which may contribute to the spread of the virus. In terms of the central database, this is to improve integrated planning across all the government institutions. When we go to biometrics, on the next slide number 15, on slide number 15, just to emphasize that over the years, as SASSA, we have been emphasizing that we are investing in biometrics. However, due to realities of COVID-19, we have had to suspend the whole rollout of the biometrics across the country. We can confirm that it's already piloted. The systems are available. When the situation is right, we will just do the rollout. But for this financial year, we thought it's important to suspend for the rest of the financial year, because we don't know how far this challenge will continue. On the SRD applications, we have had to increase the target from 50,000 in the first quarter to 104 because of the high demand that came as the challenges of the lockdown were increasing. The next slide, which is more on the administrative changes that we have made. In terms of the compilation of the financial statements, we have just moved the target to the next quarter. In terms of the payment of the suppliers, we're still striving to pay 100%. However, there was 2 months that we've lost during the lockdown, which makes it difficult to make up for the 100%. But for the remainder of the year, we will strive and ensure that we reach 100%, because empowerment of suppliers is critical to SASSA, and we will not do anything to compromise them. On the misconduct cases and also on labor relations cases, we had to reduce the target because of the lost time, but other than that, because of the most people now that we are working on rotation of staff, so we have had to put restrictions in terms of what we can do. But other than that, some of the investigations require face-to-face interventions, which we are not able to apply fully. On the implementation of slide 17, on the implementation of organizational transformation, we will continue to implement the transformation initiatives. However, we have had to amend the changes in terms of the quotas where they will be implemented. Some of the changes in terms of business processes, because of the COVID-19 measure, we were forced to introduce some of the changes immediately, but there are long-term changes that we are working on and will be implemented, and they'll move into the outer years of the MTSF. And in terms of the review of the ICT strategy, we have just moved the target to be implemented in the different quarter. On the e-signatures, the same as the pilot that were supposed to be implemented in the Northwest, we have also had to remove it from the APP, because when you do e-signatures, it means the clients have to share the pen. And on the fraud, we have also reduced the target. Chairperson, I will just go to indicate that we have also, in line with all the changes that we have made, we have updated our risk register in order to accommodate the COVID challenges and taking into consideration the community, the impact on the community. But critical to this is the fact that most of the interventions that we have introduced to deal with the COVID measures end in October, and we are anticipating that there may be community discomfort once we have to terminate some of this. So we will continue to enhance communication in order to let people that this is a 6 months temporary intervention and people should not continue to have the expectations, while internally we continue to have conversations around what are the measures that are going to be put in place to ensure that people don't continue to suffer, because we are aware that people are losing their jobs and therefore require some support in one way or another. I'll move to slide number 22. The slide that says challenges that we continue to face. Go down. Next. On the challenges that we continue to face, Chairperson, our safety of our staff as the virus continues to spread, particularly in local offices and service points where staff had to deal directly with the citizens, and as they get affected, we are forced to open and close offices, and this impact on the service delivery. We also continue to implement us to deal with the safety of clients, and at the same time, we have to balance that with the continued demand for services as more and more people are losing their jobs. We've also have to deal with the backlog in terms of processing of the COVID-19 SRD grant, which now we are comfortable that we have made major strengths in terms of addressing the backlog. We're also dealing with the challenges regarding the legacy system, and we are now aware that we need an agile technology to deal with the urgent changes as they happen. And as I conclude, is just to indicate that we anticipate high demand on the social assistance as more and more people lose their jobs. And just to confirm that as we are implementing the new COVID-19, the asylum seekers and the new special permit are being accommodated, and we are working on measures to deal with that. I will ask CFO to continue on the budget elements, which is the next slide, which starts on slide 24. Next slide. Slides number. CFO.
Yes. Hi. Good afternoon, Honorable Chairpersons, Deputy Minister, and honorable members. I will be able to take you through the financial changes that have happened. Based on what already has been presented and the requirement of the funding, this slide primarily tells that we considered about 3 main sources of funding. The first source of funding, we submitted a request to National Treasury for the special budget adjustment. We did not get any funding from Treasury. The second area that we looked to finance this, we looked at the retained surplus for the year 2018-19, which is cash in the bank that's us ahead, but we need to utilize that money if we get Treasury approval, and also the 2019-20 retained surplus. This engagement is still an ongoing. We have not concluded this. The third area that we looked for funding was to reprioritize the funds within the SASSA baseline. So this slide was only to project that. Next slide, please. The slide 24, Chairperson, is the slide that we did present to the committee in the previous, when the committee considered the APP for 2019-20, to say that SASSA's budget has not changed. It's still sitting at 7.7 billion rands, so it has not changed. On slide number 26, we were just depicting, when we came to the committee, we reflected and said 88% of SASSA's budget is split between the contractual obligations and the cost of employees. So if we were to reprioritize funding, the main areas that we need to look into is the compensation of employees and also the goods and services. The slide number 27, it reflects the material needs within the organization related to the COVID-19. Honorable members will note that this excludes the requirement for the PPEs. We repurposed 16 million that we already bought for the PPEs within the organization, but the rest of the other areas sum up 296 million in terms of the needs for that. Next slide. Slide number 28. Slide number 28 indicate where we have repurposed an amount. So slide number 28, it really gives you the summary of where we have taken money.
CFO members.
105 is disturbing us. 105.
Can you please mute your mics?
They are disturbing us.
Really, we don't hear anything because.
Please proceed, CFO.
Okay. Can you hear me, Honorable Chairperson?
Yes, we can hear you loud and clear, CFO. Thanks.
Okay. So slide number 28 gives a summary of where we have taken the money or repurposed money. One is the communication. The communication here, we're referring to the telephone usage mostly by the officials. So we have actually saved about 34 million projected savings just to move it from the communication in terms of the telephone. And we are taking repurpose 16 million from traveling because we have had limited traveling ever since COVID started. We also had a leverage around the medical assessment. The fact that the Honorable Minister did extend the medical assessments, those disability grants up until the end of October. So we did not have to do the assessment for those people. So we repurposing 28 million from medical assessment as a result of that. We also realized projected savings on some of the leases that we have now taken occupation of, about 8 million. And we also reduced the venues and facilities because the direct contact is not taking place now. So because of the social distancing. So the meetings are already happening virtually within SASSA. And we also looked at training to take about 6 million from that. On total, Honorable Chair, we're repurposing 96 million to cover those projects that we have already indicated. But looking at that, most of the amounts are locked in goods and services and are contracted. We have looked at suspending some of the positions that we're supposed to fill during 1920. And we're going to be filling them in the following year. That is in your slide number 29. So we are taking about 200 million just to repurpose that to the immediate need, while we will be able to fill these positions later on in 2021-22. to meet whatever we required for that. And that's a summary of how we have financed the emerging needs within the organization. Thank you. I can hand over to the CEO.
Thank you very much, Tsaki. Thank you, chairs. Thank you, members of the Portfolio Committee. The one critical thing to highlight is the fact that because we did not get any allocation for us to be able to manage this, these new programs, that's the reason why we've had to find money within the cost of employees, which will particularly now impact. But we thought it was very important for us to look at, not to find ourselves in a situation where we're spending money that we don't have. We're given the responsibility without a budget. We therefore needed to find money within the current existing budget to make sure that we fund these. The other key thing to emphasize is the fact that coronavirus has had also quite a negative impact in terms of our staffing. As a result, we've been opening and closing offices, which has impacted heavily on service delivery. But more so, it has also impacted on our people. We've had just in Eastern Cape 5 deaths already, with one happening a day before yesterday, where we had a loss of also from coronavirus. So the impact on our people also has been just as challenging.
CEO, we can't hear you.
Different opportunities for us to be able to make sure that those, particularly the new applications for disability grants, that those people are actually supported, and we're engaging all the doctors that we had previously for them to be able to provide support. Can you go to the next slide, which is the last slide? Lindiwe, can you go to the last slide? Lindiwe? I think the Secretariat is either not able to change the slides or cannot see us. So we are presenting the objective of today was basically to present the changes and the things that we've done for us to ensure that we manage the COVID programs that we've had to do, and also to indicate what changes are going to happen in relation to our APP. And we also wanted to indicate to the committees and request for support in terms of implementing the programs that we have, and note the different funds that we needed for us to be able to do the programs that we need to do. Thank you very much, Deputy Minister. Thank you, Chair. Thank you, colleagues. And thank you very much to the honorable members.
Thank you very much, CEO, and then for the presentation of SASSA. Honorable members, let me now take this opportunity to give over the meeting to the co-chair, Honorable Gillian, which is going to deal with the remainder of the meeting until we share the agenda. Over to you, Honorable Gillian. Lindiwe will assist you in terms of the honorable members, the list of honorable members that wants to pose their questions, and then we take it from there. Over to you, Honorable Co-Chair.
No, I can be, but it's my meeting. So we is the one that must tell the officials.
Thank you, Chairperson. Can you please mute yourself? Thank you. Thank you, Chairperson. I did receive the list. I've got 11 members that wants to ask questions. The first member that I will allow is Member van der Merwe.
Thank you very much, Honourable Chairperson, and thank you very much to the department and I would like to add my voice to what the acting chairperson said in terms of our chairperson. We wish him well. I didn't know he was unwell, but we hope that he will recover, and we keep him in our thoughts and prayers. I would also like to say that it's good to see the Deputy Minister with us today. It's nice to interact with your Deputy Minister. Chairperson, I just want to make a general comment, and that is possibly to the acting director.
Member, can I ask the members to please switch off their mics? Thank you. You can continue.
Thank you, Co-Chair. Maybe just a short comment that I would like to make to the acting Director General, and that is that the DG, we're getting our amended presentations very late. Last night we received an amended presentation just after 7, and normally the general rule is that these presentations should come to us 48 hours before. And I really hope that we can improve on this going forward. I know it's extraordinary times, but I just thought I would make that comment. With regards to the SRD grant, I wanted to establish what is the current backlog in terms of paying out these grants. How many remain outstanding that we haven't paid? Have we put in place, is the review mechanism already in place? So in other words, is there a number or a WhatsApp number or SMS number that we can communicate to our constituencies currently, CEO? Because, you know, at the end of the day, people really see us as representatives of SASSA. So people phone us at any time saying that they've got a problem, they've been rejected, they cannot get through to the call center numbers, they're unable to get help, and we then become the first point of contact. So I need to know whether when people have got problems, have you established the review mechanism? Are those numbers in place so that people can actually be assisted? I would also like to ask, we previously spoke about approaching... Yes?
Member van der Merwe, please be briefed. We don't have a lot of time. There is a list of 12 members still.
Okay, I'll try to be very brief. How far are we, or how did the negotiations go with Treasury in terms of additional funding for this SRD grant? I would also like to know with regards to the application or the court ruling with regards to temporary asylum seekers and people with special permits. What will be the budgetary implications of this? Have you received applications as yet? And also, will temporary asylum seeker people in possession of temporary asylum seeker permits, will they also be eligible to apply? So have you received any applications from refugees and asylum seekers as yet? I would like to say also it was good to hear that SASSA will be moving to an online application system for all grants. Hopefully this will actually help us to deal with the long queues at SASSA offices. I would like to know about the social workers, the 1,089 additional social workers that have been deployed. In which provinces?
In conclusion, Member van der Merwe.
I've got so many more questions. Okay. The social workers, let me just finalize this question, Chairperson. The social workers that have been deployed, in which provinces are they delivering services? Under which national provincial directorates are they providing services? And what specific services are they providing? You can give me this answer at a later stage in a written format if you don't have the answer today. I'm also concerned because the thing is we're speaking about the fact that we're going to be training less social workers.
Member van der Merwe, are you still there? Can we continue to Member Maleka?
Thank you, Chairperson. We welcome the presentation from the department. My issue is on Program 5 targets from DSD. There is a new target of 10,000 plus youth participating in the sexual and reproductive health and rights online advocacy, the Isiakwazi Youth Network in the 52 districts. Chairperson, does this program cater for those in the deep rural areas without any access to online programs. I want to check that. And on SASA, what is the current backlog of the social relief of distress applications? Thank you, Chairperson.
Thank you, Member Maleka. The next member is Member Abrams.
Thank you, Chair. Can you hear me?
Yes, you can continue.
Okay. Apologies, my video does not seem to be working. I just would also like to extend well wishes to Honourable Gumgubela for him to please get well very quickly. And in noting that, I wish he was here, Chair, so that he could take note of my next point, that I am very much concerned about the new APP and the budget, because I don't want to be told that I have a split personality again. And I do not think that Treasury has given the department enough. The very fabric of our society rests in its people. And if we don't invest in our people, the material things we invest in don't mean much. And I mean, Treasury didn't give us any money for ECDs. No, the 64 million was repurposed from infrastructure budgets. And I sometimes wonder if our children had the ability to block major highways and make demands, if they would actually receive the funding they deserve. But because children and seniors and disabled persons and women are all seemingly invisible to Treasury, we don't get the money that we desperately need. And because the priorities are seemingly elsewhere, SOEs, public wage, etc., we now have to cut training for social workers. We have to cut parent support programs. We have to cut substance abuse treatment facilities. And we have to delete targets for anti-fraud training, which has been a thorn in the department and SASSA's side for many years. And we speak about teaching boy and girl children in the home, yet we're cutting the actual support to the parents in the home to bring their children back from that line of joining a gang or going into a life of crime. And we're cutting services from social workers who need to render that GBV counseling service. And I just want us, and I know everybody in this platform are true champions of, social development, but we really need to express this to our Treasury Department, especially hearing that SASSA did not get any additional money. And I sometimes wonder, my question to SASSA is the top-up for the child support grant to address our foster care crisis, is that money now still safe, going forward? And then just second lastly, I had a look at the list of the 25 targets under Program 4, and I can't see which of those new targets speak directly to GBV. The department can just point that out. And then lastly, Co-Chair, the issue of ECDs. And I just want to, I understand everybody in this platform knows that, it's more than children coloring in pictures, and it's more than doing frog jumps, and it's more than babysitting. But the outside and also Treasury need to know that it's more than that. And when I look at the 60-page SOP document, I just want to find out from our legal team, because my understanding is that it's a guideline, and guidelines are just that. It's not mandatory. And now we have ECDs who are opening, and there's no gazetted directives on which they need to open. And I just don't want us to land back in court, because if it's going to be this 60-page, hard to follow, only available in English SOP, we're going to leave many more children behind, and we may just find ourselves back in court when instead of fighting each other, we should be fighting the virus. So if we can just have a legal perspective on the guidelines and the SOP, and when we will be getting some directives in that regard. Thanks, Co-Chair.
Thank you. We move to Member Aris. Is Member Aris there? If Member Aris is not available, we move to Member Christians.
Chair, can you hear me?
Is that Member Aris?
It's Member Aris.
You can continue, Member.
Okay, thank you very much, Chair. Chair, mine is on the disability grant. Disability grant applicants that were entitled for this disability grant, will they be entitled for this disability grant since the date that the doctor have approved them for disability grants, since there was a problem with SASSA with this disability applications, and how will they deal with the areas where they struggle with, that they have a problem with doctors to approve these disability grants? And then also for SASSA, since the department indicated there was public service employees that also did apply for the 350 rand, how many of them are there? And what is the process of bringing these culprits to book? And then within the adjustment budget from all the entities, within the adjustment, how many jobs was created from all these entities, from NDA, from SASSA, as well as DSD? And then also for SASSA, since the people received this declined SMSs, and it now shows pending, it's no more declined, it's pending now. What's the turnaround time? How long will this pending status be before the final approval for this 350 rand? And then, Chair, I also noted that on SASSA, on the youth sexual reproduction health rights, this online advocacy campaign, my question is, how will they reach the deep rural areas, there where people don't have access to technology? And then in terms of the capacitating of social workers, the 500, I say only 180 has been capacitated. What are the plans, or how will we ensure that the rest of these people also get capacitated? What plans do they have in place? And then, Chairperson, in terms of the ECDs, we would like to find out how will they strengthen the ECDs. And then in terms of the labor relations issues, the fraud issues, I've noted that there's 50% being reduced. We would find out what alternative measures are there in place to conduct these investigations and to continue with this disciplinary and labor relations issues. Thank you.
Thank you, Member Aris. Member Christians.
Thank you, Chairperson. My first question is around my concern about the allocation for funds and targets towards the very pertinent and most social burning issues in our country, which is poverty alleviation, gender-based violence, homelessness, and drug abuse. Now, in Program 2, an additional 50 billion was allocated for the social relief packages. And this is to be spent from May to October, which means there's 213 billion rand allocated towards that. Now, the food vouchers and food parcels have all of a sudden gone silent. We have no direction with regards to that, and it has just gone quiet as to where they are being allocated and how they are being allocated. The queries around the 350 rand for the social relief of distress, so many people have had queries, so many people have been declined, and we would just like some answers as to how this is progressing, how many people have received the 350 rand, and will people be assisted by October? Now, as far as gender-based violence is concerned, the homeless shelters and the drug abuse, I'm concerned that so little is being said in both the targets as well as the fund allocation. My concern is also about the long-term plans that are in place. It seems to me there's no real political will as far as gender-based violence is concerned to really target it and deal with it once and for all. I would like to call on the Minister to call the provincial MECs to come and report to us how they are going to implement these funds and how they are tracking and assisting in terms of gender-based violence and homelessness. And then lastly, my question is around Program 4, around the ECD centres. Now, why did it take the department such a long time and delay in the opening of the ECD centres? it has caused massive job losses and economic losses in this sector. Now, I would like a real response and a real answer in this regard. Why did it take a court order to sort out the matter? Has it been, in fact, sorted out? Are ECDs sufficiently assisted and aided in this matter? Thank you very much.
Thank you, Member Christians. We move to Member Masango. Is Member Masango available?
Yes, I am, Chair. Thank you so much, Co-Chair. I would like to also thank the department and SASSA for the presentations, and also just want to express my wish for the chairperson of the committee to get better soon, and we really would be praying for him for his recovery. Chairperson, I've been covered in terms of questions that I had. I just have two questions that are outstanding. In the document that was sent in the beginning, where there was a sort of statements from the minister and the deputy minister and the ADG, all of them, without fail, really expressed the need for more efforts to be made to bring the social services to the ground because of the escalation and the increase of the social ills in the sector. And to remedy this, especially the ministers, are talking to the bringing in of the social workers that are trained but unemployed into the sector to deal with this. But then when you go to the presentation by the ADG earlier on, it seems like one doesn't get a sense that these social workers are coming on board. There was a mention of the social workers that will be in the system for 3 months. There is no talk of, or at least I didn't get a sense that all the social workers that are available and are willing to work are actually coming on board, as we see or observe the social ills really, overwhelming the sector at the moment. And the next question, Chair, is the question that relates to SASSA. I want to re-emphasize, and the presenter from SASSA, Ms. Raphahle, spoke to this, but I cannot emphasize enough the poor or just confusion in the communication that comes out of SASSA about especially the SRD grant and the information about the staggering of payments of grants and the actual application. An example here, Chair, which is the main question about this issue, is the fact that in SASSA, it looks like within SASSA itself, between the head office and the actual people that do the work on the ground, there is no communication that says that all the people that qualify to apply for child support grant can apply. Because what seems to happen is that people are told that only the people that have babies from for this year can apply, which is not true, because I believe from SASSA themselves that people that have fallen into the ranks of not receiving any income can actually apply and for their children, for the child support grants. So I would really like some clarity on this issue. And the very, very last question, Chair, which has been touched by other colleagues, but I would like to approach it from this end. What is the status of food parcels versus food vouchers, and who is distributing this, and what is happening in that sector? Because the hunger of people is increasing, and the department in the last meeting, whose tail end I caught last week, was saying that there is a huge problem. I just would like to know what is happening in the food relief, especially food vouchers or food parcels, between SASSA, between the department, and whomever else that is doing this work. What is happening? There are so many questions. People are hungry. Thank you, Chair.
Thank you, Member Masango. We can move to Member below Kula.
Thank you, Co-Chair, and good afternoon to everyone. And the best wishes to Honorable Ngungubele. Co-Chair, before I ask my question, let me be irrelevant by raising a concern that need everyone in our country to think aloud on the matters of the raising up of the numbers of GBV cases. DM, I'm still in a shock now after learning about the 2-year-old girl that was raped at George Mukari Hospital after being placed in isolation because of the COVID-19. I'm just asking myself as to where is our safety? Where was the Department of Health, the nurses in the hospital during that time? And what is it that the police are going to do about this perpetrator? I know that the president has said that they need to be given the life sentence. But to me, this animal doesn't deserve the life sentence. They only deserve to be killed. I think Handball can do. Co-Chair, under Program 4, my question is, on the 100 meters trained on parenting program deleted, this deleted target is in a manner linked to the provision of social workers. Has there been any consideration on alternative method to support these local social workers with the necessary training and provision of the necessary tools of trade to at least be trained virtually? On the 500 social workers capacitated is reduced to 180. What are the implications of the reduction? Have alternative methods been explored in attempt to ensure that even though the majority might not have access to adequate tools of trade provision, is being to ensure that are supported? On the program 2 NDA, on the digitizing of capacity building programs, how does the digitization of these programs take into consideration that some of the IT challenges that may be experienced by those who are meant to benefit from these programs? On the adjustment of budgets, what are the implications of programs losing money? The last co-chair, is the budget sufficient enough to deal with the socio-economic impact of COVID-19 as well as assisting civil society organizations during this period? I thank you, Chair.
Thank you, Member. Member Dongeni, you are next. Member
Chair.
Dongeni.
Thank you, Chair. My question is on 350. There are some people get a message, return approved. But it's 2 months, nothing happened ever since they received those messages. Can SASSA give us the information, what's going on, what's happening, what's the problem? The second one is on NDA. How many volunteers work have been created by the National Development Agency? Hence, there was 32 million budget directed at creating volunteer work. Can the NDA provide, not NDA, I'm sorry, NDA provide with a breakdown of volunteer work created per province? Thanks, Chair.
Thanks, Member Dongeni. Member Ngwenya.
Thank you, Chairperson. Firstly, I would just request from co-chairperson that for asking questions, can we please be allowed to follow the list as it were, because we have already risen hands or we're in the beginning of presentations, and yet we are given last chance to ask questions. So can we follow the list as it appears on the conversation line, please? My comment firstly is that as the country, we are in the situation that we are in because of the disregard and the procrastination on the part of the Department of Social Development. I'm saying this because take, for instance, the issue of the 350 Rand grant. If the department had implemented the recommendations that were made by the Taylor Commission in 2002, that the basic income grant should start being paid, we will not be in this position that we are at now. Now we are faced with a huge number of unemployed people that the department cannot handle, that they are not able to give the money for unemployment. Whilst on that as well, which is program 3, it says that the department is on discussions on the feasibility of this BIG. My concern is that it can still not happen. And because if the department was prepared to do it, it should be in the budget now to indicate that they are going to implement this basic income grant for people who are unemployed until they get employment, because the 350 until October, it serves no purpose in the lives of the people of South Africa at all. Also on the issue of GBV, in the beginning of presentations, it is my understanding that DDG Nxumalo was supposed to give a presentation of some sort. I'm thinking that it was based on GBV, and I'm wondering why that did not happen, because this is a very serious national crisis, the issue of GBV and femicide and children abuse. So that is something that should be spoken to every single day, especially in this portfolio. And it really surprises me that even in the budget, nothing speaks on women, nothing speaks on GBV. So this budget really, it says nothing. And this says to me that women and children still do not matter in this country. I also want to find out also on the issue, to make a comment as well with SASSA on the issue of this disability grant of 1,860. People who should be qualifying or who qualify because their doctors have granted them that they are qualified to get this grant, and they are unable to apply. They are told to apply for the 350 unemployment grant, which is very, very unfair. And it is said that it is for protecting the district surgeons from having to come face to face with these people. And yet there are district surgeons who have come up to say they are willing to take up these new applications. They are willing to do the work. So what is holding up SASSA from continuing with making sure that the new applications for disability grants of 1,860 do take place? I'm also concerned, co-chair, with the 32 million rand that NDA has allocated for the volunteer support program, and that it is squarely in the hands of the CSOs that are under NDA. And we are all aware that the CSOs that are under NDA have been very problematic from the beginning in terms of accountability, in terms of reporting, in terms of meeting the requirements. So I am worried if this 32 million rand that is allocated for this will be used in a proper way. Yet again, as my colleague said, it is disappointing that out of the 500 social workers, which are not enough as it is, where money has been wasted to take them to school, only 180 now will be trained. They will never serve any purpose to serve this country with the situation that we are faced. It will be very nice as well with the NDA when they say that they are looking at using some cooperatives or community-based organizations in terms of manufacturing the PPEs. It would have been very nice if they come to us to say these are the cooperatives that we have identified, that we are looking at capacitating, that they are going to provide and manufacture and supply the PPEs, rather than saying they are still looking into it. Chair, I will stand there with my questions. I will also send written questions to the committee secretary, which also that is a problem in this committee, because we send questions to the department through the secretary, which I know she sends, but we never get responses on time. But we will continue to send those questions, and hopefully this time they will answer. Thank you very much, Chair.
Thank you, Member. We will move to Member Soekers now, but before that, I just want to remind the members that we are two committees in this meeting combined, and if you think that you did not get a chance on your right, you must remember it's the NA and the NCOP members who send in questions. So let's move to Member Soekers. Member Soekers, are you there? If not, can we move to Member Breed?
Chairperson, I see, this is Member Breed. I see Member Soekers is just muted. And I see she is trying to unmute herself.
Okay. Let's go for Member Soekers. Member Soekers, are you there?
Co-chair, can you proceed? In the meantime, I'll try to request IT to sort it out. I think it's a similar problem she experienced last time. Thank you.
Okay, I just want to caution members. I've got 3 members besides Member Soekers, then it's 4. It's Member Breed, Mama Jane, and Member Mvana. The NA also have a sitting, so if we can be just cautious of time. Thank you. Member Breed, you can continue.
Thank you, Co-Chair. And in Afrikaans, as the chairperson always greeted me, ek hoop u baie vinnige beterskap toe. But to get to the questions, Co-Chair, speaking of ECDs, and I think Member Abrams did cover it, but if no maintenance was done for the 3 months that ECDs were closed, does the department not envision that we will have a great demand for maintenance to be done on ECDs when they open, and how are we going to counter that? And seeing as we do not have that funds, I would like the department to answer to that. And also in terms of, I've been having complaints or received complaints regarding members of the department that are actually threatening the private ECDs that are starting to open after that court judgment, to tell them that they should only be stamped and approved first before they are allowed to open, and that is in direct contravention to that court judgment. So I would just like to know from the department whether they are aware of this and how are they going to address this. And I think it was Member Abrams that said we should maybe get clear legal direction as to what we are going ahead, and I would like to support that. Chairperson, then in terms of social workers, I know specifically social workers in the Northwest province, those that specifically work with veterans. They've recently been informed that there are currently no funds and that their stipend of 10,000 Rand will be stopped, and they are not being told if it will be a month or 2 or 3 months. They've just been told indefinitely. I would just like to find out from the department whether they are aware of this, and what can we do or what is being done in this regard. In terms of the in terms of SASSA and the disability grants that have lapsed, I know of a few members who were supposed to lapse during this COVID period, and of course they are not supposed to lapse, but they are not receiving those grants because they are being informed that their grants have lapsed. Is there a way? What can those members actually be doing in terms of ensuring that they receive those grants? Because some of those are really members who have permanent disabilities, and they are really worried about that. Chairperson, then just in terms of the SRD grant, the 350 Rand of SASSA, I received a call last night from a lady. She applied for the 350 SASSA grant, and she received an SMS that says she received a pension, but she was born in 1995, and she's just worried. She does not know how to handle that. Is there other problems that the department is aware of? Also taking into account that I think it was in May month that there were glitches in the system with double payments and people not being paid. Is SASSA aware of this, and do they foresee that a glitch might have stepped in there? Lastly, then, co-chair, in terms of the 350 Rand grant, and I want to actually reiterate what my colleagues have said, and that is one of my greatest fears as well. I have people who have been declined, who have phoned SASSA and have been told that they are on review, but when they log into the system on that srd.sassa website, it says that their May month SRD grant has been declined, but their June month is pending. And I do see that there is no way that we can still review or you request a review on that web page. So if SASSA can just provide clarity in terms of that, also in terms of the review of these. I was informed that one of the SASSA officers said, no, give us 2 weeks in that regard. Can we have a clear deadline in terms of that? And I also know during our previous meeting, SASSA indicated that we will not have enough money as is to pay those 350 SRD grants for the next 6 months. In terms of the allocated budget, how is that looking? What are we standing at in terms of that? And I would really like to make a request. The previous COVID-19 update that we received 2 weeks ago, that the department actually per province indicated who has been declined, who has been approved, who has been paid, whose banking details are awaiting. I would recommend or I would request that maybe we can receive such a presentation again, because it was nice and clear, and we could send it to our MPLs and actually provide feedback to tell the people that here is proof something is happening in terms of that. But that's just my take. Thank you, ma'am.
Ma'am Jane.
Thank you very much, Coach. The time is gone now for us to ask our own question, but nevertheless, I just want to comment or make a question on the issue of SRD. I'm from the Northwest Province. I want to get it clearly, because I heard the department saying they are intending to do the electronic USSB for the pensioners, while people were in my constituency, they still not have benefited from the issue of 350. They all flock to the office there at the office, because they don't have gadgets to can apply on gadget. They rely on the offices, but because the offices doesn't have staff, they run shortage of staff, and then they can't come, all of them is skeleton, but they are still I want to ask the department, why is this volunteers that they talk about? Or is that the NDA, or is that from, why is now they engaging development workers now this time? Why they didn't engage them before? And then I need to support those honorable members that says we get to the gist of our provinces, the policies, so that they must give us some of the answers, because they are not on the ground. They are up there. Their communication is not working on the ground. And then I want to say again, I will never ever participate in the budget that doesn't talk about women. We have to talk about women. I don't know, even on this volunteers from NDA, there's young women. It will be young women from other places, but other provinces don't have. I want also to get that list that says in this province, so that we must engage our province and ask where is from that side, because I'm talking for the rural of the rural. I'm from the rural, so always I will speak for the rural. So while we understand the problem where the social development come from, I want to know if this what you call that they are saying the remove of some of the target is not going to implicate some of the issue that they talk about. Thank you. I don't want to go too much.
Thank you, Mama Jane. The last member is Member Mbana.
Thanks, Chair. There's nothing new that
I have also raised.
Chair, are you giving me a chance?
Chairperson, can I interrupt a bit? Member Mutaung also indicated that she would like the last person.
Chair.
Thanks.
Thank you. Let me stand by. Chairperson, are you giving me?
I can't hear you.
I am Honorable Mvana. Are you able to hear me now?
Okay. Yes, you can continue, member.
Thanks, Chair. I won't waste time. First, let me pass a word of speedy recovery to our chairperson. The second one is to say, honorable members, the pandemic is starting to be very rife. We have lost 2 social workers for now in our province, in fact, in where I am deployed. And also I would like to emphasize this one of the gender-based violence. I would like to get from the department on how are they going to handle this issue of gender-based violence when we can hear throughout the news, radios, social media, that it's becoming rife and rife. Looking at the way on what they say that they haven't managed to get enough money for that, because we don't want to hear about the over expenditure nor the under expenditure. We don't want to hear those things. So if they can explain to us on how are they going to handle that. Maybe the last one, I'm also concerned about that they can post that we know that they've been hanging since. How are they going to handle it? Because what we need to do is to prepare for the real budget that will be tabled or will be tabled by the finance minister during October month. That's the 2 questions that at least I think I will die if I don't ask them. Thanks, sir. I'm done, Chairperson. I am done, Chairperson. Thank you.
Okay,
Thank you,
Chairperson, I would. It was one.
I can't hear.
Thank you, Chair.
Hello?
Chairperson, can you hear? Hello, Chair, can you hear me? Chairperson?
Who's speaking?
It's
Yes, I can hear. Who's speaking?
It's Anastasia Mtau. Can you hear me, Chair?
Can the secretary please assist who's speaking now?
We can
Good
hear
afternoon,
Honorable
Chairperson.
Mutabu.
The person on stage now is Member Mutaung, a member of the NA. She's the last speaker in this meeting.
Okay.
Yes, ma'am.
Okay, thank you. You can continue, member.
Thank you, Co-Chair. Let me take this opportunity to thank the department. My question is on Program 5, on the EPWP work opportunities created through DSD program. Has the department explored alternative methods of ensuring that the reduced difference between the initial target and the revised target, either through other government departments or social partners? And then the second one is on SASSA, on changes to existing targets within core business. What are the implications of targets such as to payment of suppliers within 100 days, conclusion of financial misconduct, cases and labor relations that have been reduced? That's number 2. And the third one is on the adjustment of budget. How much money has been moved from which program to which? And then the last one is on NDA. I want to know from the NDA, what process are they using for the recruitment of volunteers? Did you catch that one? On the NDA, the last question.
Yes, we did, Honorable
Yes.
Member. Thank you very much.
Okay, thank you. Thank you, Chair.
Is that the last one, member?
Yes,
Thank
it
you,
was the last one,
Member
Co-Chair.
Stock, do you want to come in? Members, we only got about less than 40 minutes left of this meeting because the NA will start at 3. Now, the way forward, I think, is that we give the department a chance to give us questions in writing, and we will ask the DM to wrap up and answer some questions that she still can answer. But before that, DM, I really want to ask, what is your measures that you have in place at your offices to curb the overcrowding at the offices? And when I refer to offices, it is the SASSA offices, because our old people are sitting in the cold throughout the night, and we are very worried. We need to know what is the measures that's been put in place at SASSA offices. And then nearly all members have talked about the SRD. I think we need all those questions and the social relief, the grant and the food parcels, whatever, but all the social relief in the stress projects from this department. I think we need to get everything that the members ask in writing, and also all questions referring to NDA and also the questions referring to SASSA. Our people are hungry outside. Our people are dying outside. And all in this country is looking up to this department. Please, Deputy Minister, with your department, can you provide both committees with all the answers in writing? But Deputy Minister, I will hand over to you before the members of the NA must leave. Thank you.
Thank you very much, Chairperson, and thank you to all the questions, honorable members. We really appreciate. And thank you, Chairperson, for the guidance. We would like to say we will make sure that all the questions are written, are responded to in writing, as this will also enable the members to be able to have something to say to their constituencies. But allow me to just remind the members once again to say the presentations were made only on the targets that we were changing. So the targets on gender-based violence, we are not touching them. We are not changing anything. Hence, it appeared as if we are not saying anything about gender-based violence. It's just precisely that we're not touching. It remains as approved by the members when we submitted it. We only spoke about the ones that we are amending. So I would like to say the presentation that we had made on gender-based violence remains the same. The interventions remains the same, and that target is a very important target to social development. Hence, even in the review or shortages of money, we are actually not touching that. So that's the first one. The second one, just to round up on the issue of early childhood development, I just wanted to indicate that the court order was about the opening of private early childhood development centers. And just to say to members, they do operate on a social development license. In the judgment, one of the most important critical areas that the judge has spoken to is that as much as they are being granted the right to open, but they must be compliant. So it is very important for team social development to ensure that those that are opening are actually compliant in terms of the protocols and that they have reviewed their particular areas. With regards to maintenance still on ECD and the repurposing of the grant, I just want to confirm to honorable members that the grant that we have taken was for us to actually maintain not your existing ECDs, but to bring in on board new ECDs, which are capital projects. And given the challenges around the late construction that has been closed, we then felt that we should take some of that. And to say early childhood development, we support NPOs who run, and we want to say it is only we're only taking the money for the construction of new ECDs, which we will construct next year. But the maintenance of ECDs that were already approved, that will be continuing, honorable members. On the issues of the homeless shelters, I want to confirm that that is there because we are not touching that particular APP, that particular targets. Hence, we did not say anything about them. So they remain there as we are continuing with the strategy as presented when we presented the first. We noting the challenges around the disability grant and all the concerns raised, and that will be in detail in a booklet, including SRD, the update from the presentation we made on the food distribution at the previous meeting. We will update that, especially as members are going to the constituency offices, so that that particular area is clarified. We've noted with concern all of the concerns around the 350 and some of the concerns we've raised ourselves, honorable members. And there are three things. Of course, the officials will be charged, those that have applied, but other officials have applied with their cell phones for members who qualify who don't have cell phones. So there is that needs to also be sifted, because we also have members of parliament that have assisted people in their constituencies who qualify for the 350 but don't have cell phones with their cell phone numbers. So we are separating that particular aspect where a person requests to be assisted and doesn't have a gadget, and those that are actually committing fraud. The issue around the social workers and the training, we've noted all of that. And to just say to members, the training of social workers was in line with what we presented to the committee a while ago. that we are taking some of the scholarships as well as to absorb social workers. So it is in line with that particular aspect, and we continuing to absorb new social workers. But we also have a lot of the different programs which we will come back to the committee to report on that will be providing more opportunities for our social workers to be able. The 1,809 social workers, and not all of them have started. Some have started, some have not. So when we respond in writing, we will allocate, as the members have requested, that we also indicate where they are placed. We will do that, and I'll personally make sure that that reaches the committee in the next less than a week's time. The issues around the asylum seekers and the refugees, I just wanted to say to members, the Social Assistance Act has always indicated that we are supposed to admit the asylum seekers once they are approved and have their home affairs documentation, as well as refugees. They have always and are recognized by the Social Assistance Act. The challenge that we had was those that were waiting in the queue and that Home Affairs have not noted. SASSA would have to indicate the implications in terms of that particular transition. Given the comments from the chairperson that members of the NA need to leave and we need to close the meeting by 2:30, I wanted to just highlight the overall. The NDA volunteers, chairperson, I think we will have to indicate further, but the volunteers are the ones assigned to the NPOs that we engage their services. And the cooperatives are the ones that are registered with NDA, that NDA has trained, has incubated. The list is available. So we will make the list of the cooperatives that has been incubated, but that have also benefited from grant funding as well as training from NDA, so that members can know who they are, where they are, and how they have been supported. I tried to lump some of what we could answer now together, and to also indicate that we are filling our vacant posts, but to say to members there are posts that we are also won't be filling, that as we restructure, DPSA is advising us to actually restructure. And there are programs that we've moved to provinces, and that also have a direct impact on our structure. And I think we will have to come back to the committee to also go into details, especially for the select committee. Programs that members commented on social behavioral change, that has been evolved to provinces. The youth has been evolved to provinces. And we also moved the positive parenting, family matters programs. The provinces, that was the targets that we had set that have now moved to provinces. But to say that the 100 looks smaller, but these are the national-based social workers, because now the programs have been evolved with the budgets to the provinces. Hence, it looks like we are reducing the capacity of our social workers. And lastly, Chairperson, before I would give if the ADG would like to say something, and the two CEOs, but to just conclude by saying we really appreciate the feedback, the engagement. We are going to work throughout each question and put it together to be able to provide members with something like a small booklet on commonly asked questions, so that we get those answered, as well as the social relief of distress, the food parcel versus the 350, and then the numbers, as well as a total package on the disability grants. We will try and make sure that we put together that particular booklet. Is there anything you'd like to say, Acting DG, noting that the NA members, it's a 3-line whip, they need to be excused? Would you like to say say anything? And
yes, thank you very much, Honourable Deputy Minister and the honourable members. We appreciate the comments and the inputs and the questions. I just want to say that Honourable Van der Merwe will make sure that we improve in terms of the provision of the presentation on time. And then in terms of our record, and I've just looked at it now, our record indicates that we've responded to all questions that have been asked by members. And I think what we'll do is we'll reconcile with the Secretariat just to make sure that our numbers are correct in terms of the questions. But we remain committed to responding to honourable members' questions all the time, and we'll do our best in that regard. I think for the sake of time, I will leave it at that, and really just to appreciate honourable members for their wisdom and their continued guidance in this regard. Thank you very much. We are ready to submit.
Thank you.
Yes.
Thank you, DG. We will just want to ask that all the questions must be answered in writing, and it must reach our secretaries by Friday at 12 o'clock. That's the deadline, because they must still prepare their reports for Monday. Thank you. Member Stock, are you still here or did you leave already? Did Member Stock already left? I need to adjourn this meeting because of time, because the members of the NA is supposed to log in the 3-line whip sitting. That's why I was looking for the chairperson.
Sorry,
Chairperson Gillian.
Chairperson.
Yes.
I just want to also echo or to make assurance to member speakers who experience some technical challenges in terms of joining in the meeting, that her question will be forwarded to the department, will form part of the written response, because she gave me a number of questions, but I wanted to assure that it will also be brought to the attention of the department. Thank you.
Chairperson Gillian. Sorry.
Yes.
Unfortunately, yes, Chairperson. Sorry, I want to apologize. I got cut off while I was busy with my questions. So I would just like to request that I can also then submit the remainder of my questions to the committee secretary so that it goes with the batch of questions to be answered. Thank you, Chairperson.
Okay. So without any further ado, members, let me thank the Deputy Minister and the department and all members for this fruitful meeting. I wish you a successful sitting in the NA. This meeting is adjourned.
Chairperson and honourable members.
Yes.
We'll meet the Friday 12 o'clock deadline.
Deputy Minister.
Thank you.
Thank you. Goodbye.
We will meet the 12 o'clock Friday deadline. Thank you very much.
Thank you. Thank you, Jim.
Bye.
Bye-bye.
Bye, Chair. Bye, Chair.
Bye-bye, Tongeni.
Okay, stay safe now in Cape Town. And you stay safe till
Thank you.
I will. Later. So, okay, any meeting tomorrow? We'll talk. Sure. Let's leave this meeting. Sure, bye-bye.